The waves of life's ocean often conceal the deep, silent currents below. This analysis aimed to assess the risk of post-traumatic stress disorder following indicated second-trimester termination of pregnancy and identify associated risk factors. The study was a secondary analysis of a multi-center randomized controlled trial comparing cervical dilators with misoprostol versus misoprostol alone for termination at 15 to 27 weeks of gestation. A total of 347 women were assessed using the Impact of Event Scale Revised Questionnaire, administered 1 to 4 months post-procedure. Interventions included concurrent use of cervical dilators and misoprostol. The primary outcome was the incidence of PTSD risk post-termination, with evaluations occurring up to 4 months after the procedure.
Quick take. A comprehensive assessment was conducted to determine the prevalence of PTSD in women post-second trimester termination, utilizing well-validated tools and follow-up intervals.
Results indicated that 44.9% of participants had scores indicating possible PTSD, and 35.8% reached thresholds for severe PTSD. The analysis found no significant association between evaluated obstetric factors and severe PTSD scores. The data underscore the absence of identifiable obstetric predictors for PTSD, suggesting that all women might benefit from systematic psychological assessments post-termination. The authors conclude that systematic psychological evaluation post-medically indicated termination is beneficial, given the significant PTSD risk identified.
Quick take. No specific obstetric risk factors for severe PTSD were found, highlighting the need for universal psychological support following termination.
Short quiz, clinical vignette. A 29-year-old woman undergoes a medically indicated second trimester termination at 24 weeks and is evaluated for post-traumatic stress disorder 4 weeks later. Her Impact of Event Scale Revised score is 38. Which characteristic is unlikely to be associated with this outcome? Option 1, parity. Option 2, gestational age over 22 weeks. Option 3, use of cervical dilators. Option 4, labor duration over 12 hours.
The answer is option 2. The study found no significant link between obstetric characteristics like gestational age over 22 weeks and the development of severe PTSD, highlighting that specific factors were not predictive of high Impact of Event Scale Revised scores.